How does colorectal cancer chemotherapy infusion work? Imagine a treatment that travels through your bloodstream, seeking out and attacking cancer cells wherever they hide. That's essentially what chemotherapy infusion does for colorectal cancer. It uses powerful medicines delivered directly into your veins to target cancer cells and stop their growth. This method allows the drugs to circulate throughout your body, reaching even those tiny cancerous spots that might have spread beyond the colon or rectum. The process begins with preparation. Your healthcare team will review your medical history, perform blood tests, and explain what to expect. Once you're ready, a nurse or technician inserts a thin needle into a vein, usually in your arm or hand. Sometimes they use a small device called a port, which is implanted under your skin and connects directly to a vein. This makes repeated treatments easier and less uncomfortable. Next comes the infusion itself. The chemotherapy drugs are mixed into a solution and slowly dripped into your bloodstream through the Raman-Fa line. The length of each session can vary from a few minutes to several hours, depending on the specific drugs and treatment plan. During this time, your medical team will monitor you closely for any immediate reactions or side effects. They might also give you medications to help manage nausea, allergic reactions, or other side effects. Chemotherapy for colorectal cancer is usually given in cycles. This means you might have a few days of treatment followed by rest periods. These breaks give your body time to recover and help reduce side effects. The number of cycles and their duration depend on your individual situation and the specific regimen your doctor prescribes. There are two main ways chemotherapy infusion is used. The most common is systemic chemotherapy, where drugs are delivered into the bloodstream to reach cancer cells all over the body. This is especially important if the cancer has spread beyond the colon or rectum. The second approach is regional chemotherapy, which targets a specific area. For example, if cancer has spread to the liver, doctors might use hepatic artery infusion to deliver chemotherapy directly to the liver. This method concentrates the medicine where it's needed most and can limit side effects elsewhere. Several drugs are commonly used in colorectal cancer chemotherapy. For instance, 5-fluorouracil is often given as an infusion, sometimes continuously over several days using a pump. Oxaliplatin is another drug frequently combined with 5-fluorouracil in a regimen called FOLFOX. Irinotecan is used especially if the cancer progresses despite other treatments, often in a regimen called FOLFIRI. Capecitabine is an oral medication that converts into 5-fluorouracil inside the body, offering an alternative to Raman-Fa therapy. Chemotherapy infusion can be used at different stages of treatment. Before surgery, it can shrink tumors to make removal easier. After surgery, it helps eliminate any remaining cancer cells to lower the chance of recurrence. For advanced cancer, chemotherapy aims to control symptoms, slow tumor growth, and extend life. The way these drugs work is by interfering with cancer cells' ability to grow and divide. Since cancer cells divide rapidly, chemotherapy targets these active cells. The drugs damage their DNA, block the creation of new DNA or proteins, or disrupt cell division altogether. This damage causes cancer cells to stop growing or die. Because chemotherapy affects all fast-dividing cells, it can also impact healthy cells, leading to side effects like hair loss, mouth sores, fatigue, and increased infection risk. Your healthcare team will help manage these effects with supportive care. If you're receiving chemotherapy infusion, it's usually done in a hospital, clinic, or outpatient center. Some treatments may involve portable pumps that allow continuous infusion at home. The number of cycles and how long each infusion lasts depend on your specific plan. It's essential to attend all scheduled appointments and communicate openly with your medical team about any side effects or concerns. They can adjust your treatment or suggest ways to make you more comfortable. Remember, chemotherapy for colorectal cancer is a complex process that requires expert guidance. It's tailored to your unique situation, with the goal of controlling or curing the disease while minimizing side effects. Always follow your doctor's advice and never try unproven treatments. Ongoing research continues to improve these therapies, offering hope for better outcomes in the future. If you have questions or need personalized information, consult your healthcare provider. They are your best resource for safe and effective care.